Morning all, welcome to Health and Human Services. I will warn people, I don't think this is gonna happen, but if it gets to be a really long hearings, I need to exec some bills today, so towards the end, I will start limiting people. So, with that, we'll, open the hearing on Senate Bill 302 and welcome the prime sponsor.
Thank you, Madam Chair. For the record, I'm Cindy Rosenwald. I represent Senate District 13 in Nashua, and I'm pleased to be here this morning to introduce Senate Bill 302. This bill will make it easier for New Hampshire patients to have telehealth appointments with their physicians located in other states. This language was introduced in an amendment to a bill last year in eDNA. It passed the Senate unanimously, but died when the conference report was not signed off by one of the House members. So I've introduced it this year as a freestanding bill. The issue was originally brought to me by a gentleman from Nashua. It's actually a constituent of Senator Avar's. And he's unfortunately not able to be here today. His wife is being treated by a group of doctors in Boston whom they like and know well. My constituent sometimes has interim telehealth appointments on behalf of his wife, but because the doctors practice in Massachusetts and do not have a New Hampshire license, my constituent, or Senator Avard's constituent, has to be physically located in Massachusetts to talk to them. So sometimes this gentleman is able to get a room at the library in Chelmsford, which is private and good, but the Wi-Fi stinks, and he gets kicked off the Wi-Fi. Sometimes he sits in his car in a parking lot at the bottom part of the Pheasant Lane Mall, I think. This just makes no sense to me. Technology doesn't stop at the state border. I spoke to people at OPLC, the Medical Society within the Senate, and at the Department of Justice, it became clear that a simple, very limited licensing exemption would be helpful to New Hampshire patients. So this bill is drafted to exempt an out-of-state physician from needing a New Hampshire medical license when they have an established relationship with the patient in their home state of licensing, and they see them in person at least once a year. This way, people can have video teleconference or telephone appointments with their doctors who practice elsewhere from the comfort of home and not have to drive over the border and sit in a parking lot. I think it's a common sense bill. I hope the committee will find it ought to pass. I'm happy to answer questions. Thank you.
Any questions from the committee? Seeing none.
Thank you.
I do have one question, and if I recall, last year when you brought it forward, did we bring an amendment forward?
No, this is the exact language that came out of eDNA. It was attached in this exact form to a bill about licensing music therapists. I don't recall what the bill number was. It passed the Senate on a voice vote, went to conference, the House agreed to accede to the Senate version, and then the report wasn't signed off. So the whole thing went down. But this is the exact same language. It's really narrow, and I thank Senator Prentice actually for coming up with the idea that the relationship has to be in the home state of licensing, so that if the physician were part of a multi-state compact and was in Wisconsin or something, it wouldn't matter unless you had seen that physician at least once a year in Wisconsin. This will apply mostly to our border states, but could, for example, affect someone who goes out to the Mayo Clinic in Minnesota
Okay.
for something and then has a follow-up appointment. But the language is the same.
So my follow-up would be, so that doctor that's doing the telemedicine could only adhere to the laws in New Hampshire?
Correct.
Okay. Any other questions from the committee? Seeing none. Thank you.
Thank you.
Bob Dunn.
Morning, Madam Chair, members of the committee. I'm Bob Dunn, the Director of Public Policy for the Roman Catholic Diocese of Manchester. And I'm here today. First, let me say I think this is a good bill. It's going to facilitate healthcare for New Hampshire residents. Here today simply to make a suggestion about a possible small amendment regarding a construction clause. This would be to ensure that the new law is applied correctly. The situation, obviously, is that the laws of other states are different than New Hampshire's laws with respect to certain things, sometimes certain controversial things like physician-assisted suicide. Vermont and Maine, for instance, that's legal. It's not legal here. And so the idea would be to simply have a kind of a very short construction clause that simply makes it clear that nothing in this legislation is intended to render lawful anything that is currently unlawful under New Hampshire law. And I think that could be done very neutrally, very easily. And despite that, I apologize for not coming in here with draft language. But I spoke with Senator Rosenwald before the hearing, and I think we can come up with language that would fit that bill and hopefully would accomplish all of that. Thank you.
Thank you. Any questions from the committee? Seeing none.
Thank you.
Is there anyone here? That was our last speaker, and we have Laura McIntyre from Granite State Home in support, not speaking. Is there anyone here that would like to speak on Senate Bill 302 but was not given the opportunity? With that, I will close the hearing. You guys are doing good. I know. Sure, you want to go into exec
Yeah,
session? for a
Motion
few
to
minutes?
exec, motion to exec.
You want to go into exec?
Yep, get her done.
And I,
The one we just heard?
no, we need language on that one, don't we?
Yeah, we can do that. That's why I was hesitating. Is we have to, we've got a small fix we need to do on this.
Right, but there are some others I think that we can, and I apologize because I didn't contact you guys last night, but we didn't get done till 8 too. So I didn't know what.
At some point in the morning, if we can get a list of what we need. We've got time.
Okay.
Arriving in the list here.
All right, you want to just, for the exec session, you want to just go over it now?
Sure. Let's do
And-
that. So motion on executive session.
Seconded.
All right, all those in favor of exec, say aye.
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 Opposed? Okay, so I'm just going to run off the ones that I think we need to hold for now. So 354, we need to hold. I talked to Senator Innes, and he wants to tweak it a little bit more. 400, I saw Marissa had emailed me or texted me last night. It looks like they're starting to work on a,
Signal for compromise.
yeah. 403, I think that's still being worked out. 406 is a hold. Oh, wait, no. We got the amendment on that one, didn't we?
That was one that.
That was Senator
neither
Fenn.
one of us go for.
Oh, I found it. Oh, all right, well, we'll hold on that one. All right, we'll hold on 406. 407, Senator Prentice, that's yours.
Direct pay?
Yeah, ambulance service.
I have an amendment for just the direct pay part. Do you want, we can hold it.
Yeah, that's fine.
Do we have the amendment? Just us. I can make sure it's correct. I don't know if I sent it over to Cam yet, but I had two prepared. I've chosen the status one.
411, I'd like to hold. Um, 558. I want to hold. I do want to connect with the stakeholders, and they all have to work together, not just one portion of the stakeholders, but they need, the stakeholders on 558 need to bring in the insurance department as well as the insurance carriers. And I think that's, yep,
And I think we should still hold on 556, which is the nurse practitioner. Carrie, because although there's been a lot of work done with one of the providers, AHIP is concerned about the section that's being proposed, the statute that they're proposing to be amended. And then I did hear extensively from Cigna on their concerns. So I don't think we've got everybody
okay,
in the same place yet, but we're getting there. I did speak with Jim Monahan last week
okay,
as well. So, I mean, I'd love that to be done today, but
okay.
we gotta get
So let's just run through that. 350, the holds are 354, 400, 403, 406, 407, 411, 556, and 558. Okay.
400.
I did. I'm good. Good. All right. So, now it is 9:15. So,
Motion-
them out of executive
Second.
session.
all right. All those in favor of going out of exec, say aye. Opposed?
Thank you. That's great.
All right. I will now open the hearing on Senate Bill 408 and welcome the prime sponsor, Senator Ricciardi.
Thank you. Good morning, Chairman Birdsdale and members of the committee. I'm thrilled to be here to introduce Senate Bill 408. We have a housing crisis, as you know, but within the disability community, we need to have some way to address it. And individuals with disabilities face disproportionate challenges in accessing affordable and accessible housing. This bill acknowledges these disparities and seeks to understand their root causes. When we have data-driven solutions, we can come up with better resolution for everyone. So by establishing a committee to study the effects of the housing crisis on the disability community, we will provide valuable data and insights. By understanding the specific needs and barriers faced by individuals with disabilities, as policymakers, we can develop more effective solutions. Access to safe and affordable housing is a fundamental human right. By focusing on the needs of the disability community, this bill demonstrates a commitment to promoting equity for all residents of New Hampshire. A comprehensive study will help identify gaps in existing policies and programs, and by pinpointing areas where current efforts fall short, Policymakers can make informed decisions to improve access to housing for individuals with disabilities. I always like to take the approach of collaboration. I really think that's how we get things done. And this bill encourages collaboration among stakeholders. That would include government agencies, disability advocacy organizations, housing providers, and individuals with disabilities themselves. I really believe by bringing together diverse perspectives that we can develop a more holistic and effective solutions to this problem. Long-term benefits by investing in housing stability for individuals with disabilities has a benefit for both individuals and society as a whole. Stable housing improves health outcomes, it promotes economic self-sufficiency, and it strengthens communities. Studying the effects of the housing crisis on the disability community is in line with the principles of disability rights laws, such as the Americans with Disabilities Act. It reaffirms the commitment to ensuring equal access and opportunity for individuals with disabilities. Addressing the housing crisis among individuals with disabilities is not just a moral imperative, but also a sound fiscal decision. Studies have shown that investing in housing stability can lead to cost savings in the areas such as healthcare, social services, and criminal justice. Building a more inclusive society by taking proactive steps to address the housing needs of individuals with disabilities. New Hampshire can be a leader and lead the way in building a more inclusive and compassionate society where everyone has the opportunity to thrive. And for these reasons, I ask this committee to pass Senate Bill 408. And if you have any questions, I'd be happy to answer them.
Any questions from the committee? Seeing none, thank you.
Thank you.
Hold on, Senator. Just looking at that, you have 3 members of the Senate. Do you want 3 members or can we reduce it down?
It can be reduced.
Okay, we'll talk about it.
Okay, thank you.
All right. Sylvia Dow.
Thank you so much.
Okay. Thank you so much for discussing this very important issue. I am Sylvia Dow. I'm the Executive Director of Visions for Creative Housing Solutions. But first of all, you need to know that I'm a mother. I'm a mother of 2 adult children, now ages 37 and 39. And why did I get into being an executive director of a supported housing model? It's because of need. As most parents who have adult children with developmental disabilities in our state, we are caring for them. In 2011, I was diagnosed with a brain tumor and an infection in my brain. What would happen to my 2 daughters if something happened to me? I needed to be proactive at that moment. 10 years ago, I formed a nonprofit with other families, never knowing the need in our state. Before long, our little model that only supported 10 people, 10 individuals with developmental disabilities, we started to get inundated with applications, people interested in our model. I get phone calls weekly from families all over the state that are caring for their adult children. They're tired, they're aging, they're worried about what happens to them when they die. This is a problem that we need to address. Also, I'm a special educator. And I took time, your public dollars for special education. We work so hard to get individuals with developmental disabilities to be independent, to be part of our community. But what happens is there aren't any services for people. Now they're living at home with their parents who are aging. The parents don't have enough support at home. All of the gifts that we gave in the public school systems now are falling apart. They don't have jobs. They're not integrated in the community. By providing supported housing to help people be as independent as possible, you are saving tax dollars and you're providing support. Individuals should have a right to have support in having jobs, volunteering in the community, having friendships. So this issue really needs to be addressed. And I thank you so much because it is a crisis. And as a parent, I have to say, I want to have the right to die and have the right to know that my family and my children are taken care of. So thank you for addressing this very important issue.
Thank you, Sylvia. Any questions from the committee?
No.
Seeing none. Maddie Mendelbaum? Welcome.
Good morning. Good morning, Chairman and committee members. My name is Maddie. I am a 69-year-old and a single parent to my son, who I live alongside of, who's 28 years old. He has a rare motor neuron condition, resulting in a progressive medical condition and learning challenges. When my husband passed away 5 years ago, suddenly and unexpectedly, the question of what will happen to my son when I die loomed over us. Last year, as I underwent surgery for an unruptured cranial aneurysm, this question became more daunting as I struggled with the idea that I may not come out of surgery alive or capable of caring for my son any longer. Family and friends often remark about the stress I am under caring for my son's needs. Only recently has it become so clear to me that it is not being able to answer the question regarding where my son will live when I can no longer care for him. My son came up with a plan for his future as he was getting ready to graduate from high school at 21 years of age. He has continued to hang on tightly to his plan of moving to Los Angeles, to work for Hasbro, and to create My Little Pony episodes. It is when he approaches me with a date and a plan for a move that I know he is feeling especially despairing of ever leaving my home and having a life of his own. People with intellectual developmental disability deserve to be able to look ahead and know where they may live outside of their parents' home and plan a future for themselves. They can only do this when the community they live in offers housing options to them. As a family in these circumstances, I resent those who have never considered our families or other families' needs. Clearly, this is a state that has voted and cared far more about supporting its business and economy than its people. I am impressed that my son has come up with a plan for his future that he is able to consider when he is discouraged about the present. His plan isn't a viable one, as he cannot make this move without my help, and I have no interest in moving to California and finding new resources to care for him. However, I use his plan to motivate him around moving out of our home to a residence in New Hampshire not too far away, so that I can continue to be involved with and help care for his needs as I am able. To address my worry regarding our future, I have volunteered my time on the development team of Our Place, a residence in the making for IDD adults in Dover, New Hampshire. My son has attended activities with other potential residents and is beginning to develop a vision of life in this home. Although he isn't always on board with the idea of being a potential resident, he has said to me, "At least I know, Mom, you are not planning on my living with you forever." In conversations such as these, I am aware of how our young adults have always relied upon us parents to come up with the next step in their developmental process. When we have been able to guide and support a successful transition, it is satisfying for the entire family. But when the need to move out and live independently comes up, I am aware of an ache in my soul. I have let my son down by not having this next step planned and implemented. I watch my son living in my home at 28 years old and think about the time he has already lost in learning to live more independently and alongside his peers, making meaningful relationships that eventually take the place of us parents, so that when we die, they feel a sense of community and support to keep them going. Our IDD loved ones deserve a satisfying and meaningful future as our typical adults do. So please vote yes to studying the need for housing in New Hampshire for our IDD adults. Thank you.
Thank you, Maddie. Any questions from the committee? Seeing none. Kristen Evans? Welcome.
Madam Chair and committee members, thank you for the opportunity to testify in support of Senate Bill 408. For the record, my name is Kristen Evans, and I'm the Director of Policy and Advocacy for ABLE New Hampshire. ABLE is a disability justice organization, and we are a nonpartisan, nonprofit organization that fights for the civil and human rights of children and adults with disabilities. As a disability justice organization deeply committed to advocating for the rights and well-being of individuals with disabilities, we wholeheartedly endorse Senate Bill 408. This crucial initiative recognizes the intersecting challenges faced by individuals with disabilities in accessing safe, affordable, and accessible housing, and represents a critical step towards addressing these pressing issues. New Hampshire faces a significant shortage of accessible and affordable housing, exacerbated the housing crisis for individuals with disabilities. According to data from the New Hampshire Housing Finance Authority, the state has experienced a shortage of affordable rental units for low-income households, with demand far outpacing supply. Furthermore, the lack of accessible housing options compounds the challenges faced by individuals with disabilities, limiting their ability to live independently and participate fully in their communities. Research from the New Hampshire Department of Health and Human Services underscores the disappropriate impact of the housing crisis on individuals with disabilities. Data from Granite State Independent Living reveals that many individuals with disabilities are forced to live in substandard housing conditions or face housing instability due to factors such as limited income, discrimination, and lack of accessible housing options. These challenges not only undermine the health and well-being of individuals with disabilities, but also perpetuate cycles of poverty and exclusion. In conclusion, Senate Bill 408 represents a critical opportunity to examine the intersection of the housing crisis and disability in New Hampshire and develop evidence-based solutions to addressing these pressing issues. By establishing a committee to study these effects, policymakers can gain valuable insights into the unique challenges faced by individuals with disabilities in accessing housing and develop targeted strategies to promote housing equity and inclusion. As a disability justice organization, we urge lawmakers to support Senate Bill 408 and prioritize the needs of the disability community in addressing the housing crisis. Thank you.
Thank you, Kristen. Any questions from the committee? Seeing none. Vanessa Blaze?
Good morning, Madam Chair, members of the committee. Thank you for hearing my testimony today. My name is Vanessa Blaze, and I serve as the Director of Policy and Planning for the New Hampshire Council on Developmental Disabilities. And today I'm providing testimony on behalf of the DD Council membership, which believes that this bill would have a positive impact on the developmental disability community. At the heart of the ongoing housing crisis, there exists an untold story about the unique challenges faced by people with developmental disabilities and their unmet need for safe, stable, and affordable housing. Having a stable home is the foundation of everything that we build our lives on. Lack of housing inevitably escalates challenges that could otherwise be met through natural supports to crisis situations that unravel everything else in our lives. The housing crisis is a daily topic in our state. It is adversely affecting our social and economic stability. As we explore solutions, the intellectual and developmentally disabled are again being left out of the conversation. It is our hope that by establishing a committee to study the effects the housing crisis has on people with disabilities, we can address this need in an effective way that puts our state's most vulnerable people at the forefront of developing solutions. While weighing the decision to bring this legislation to vote, legislators and the public will hear a lot of data and statistics. While these numbers are important, we hope that our legislators also take into consideration the stories that people want to share about their lack of suitable housing and how it has been a barrier to living a safe, stable, healthy, inclusive life of meaning. Something that we all deserve, and something that disabled people should not have to wait longer for. Giving the go-ahead for the legislative committee to be formed to study the effects the housing crisis has had and continues to have on the disability community will provide an opportunity for lawmakers to hear directly from those most affected. According to the Institute on Disability, 12.1% of New Hampshire residents are currently living with a disability. This means 1 in 5 Granite Staters. It is more essential than ever to continue to support inclusion and enhance the lives of the disability community. Our council by law is comprised of 60% of people with developmental disabilities and parents or guardians. These members are volunteers advocating for disability justice, and they appreciate your consideration. Thank you.
Thank you, Vanessa. Any questions from the committee? Seeing none. Thank you. Tracy Long. Welcome.
Thank you, Senators, for listening to this very important crisis that we are in. I'm a parent. I'm one of the similar people behind me. And I just want to show you a picture of this really neat person. His name is Andrew Long. He's my son. This isn't my forte. This is how important this is. He asked me to speak on his behalf because he's working this morning at Old Navy. So I'm doing that for him. My name is Andrew Long, and I live in Alton. I support Senate Bill 408 to form a committee to look into the housing crisis for those with developmental disabilities. I am a person with developmental disabilities. I have been worried for quite some time. What is going to happen to me when my parents can no longer take care of me or pass away? I know that sounds dark, but that is my reality and countless others just like me. They have taken care of me all of my life, and they deserve a chance to know that I will be safe and happy in my own place one day with support. There just aren't a lot of options for us. I'm currently on a list of interested people for a new project called Our Place in Dover. They are trying to help solve the lack of housing for people like me. However, I'm one of more than 60 people hoping to get in on a waiting list for them where there's only 10 or 11 people who will be chosen. I may not be very good at math, but those odds don't sound very positive. Even if I were lucky enough to get in, I would feel sad for those that didn't. We need a committee to study the problem and come up with solutions. Please support SB 408. He says, 30 years old. I have worked at Old Navy for more than 6 years. I volunteer at the Cochico Valley Humane Society in Dover. I'm a stand-up comic as well. I've performed many times for different organizations. A couple of years ago, at the request of Valerie Sununu, I opened up for a big conference in Manchester. I'm a person, just like you. I am hoping you will understand this need is great. I'll do my part if the committee is approved. I'll do whatever I can to help. Thank you for your time. And on behalf of my voice, I won't read this whole thing. I passed it out. But exactly what was said behind me is you invested so much money in these people with disabilities when they were going through the education system. And it has been a great thing. Why would we want to waste it at this point in their lives? Never mind the obvious humanity that we need to protect them. After Andrew was born, I was 27. He is now 30. I'm now 59, and his father is 61, going to retire. What will happen to him? I wake up at night very fearful. New Hampshire lacks, obviously, as you can see, with the support behind me, the ability for people with developmental disabilities to live out their lives with dignity and with the support they need. I can't even imagine what it feels like to think that your child would be left one day without you around, like an adolescent. and I don't mean to minimize them. That's not what I'm saying, but I can try to get you to relate how that might feel. A 5-year-old left abandoned. It's not the same, but it is the same. So please support we did this last week, SB 408, and help people like Andrew. He's a good man. Thank you. Any questions?
Thank you, Tracy. Any questions from the committee? Seeing none. Will Walker.
Thank you, Chairman and members of the committee for the time to speak today. My name is Will Walker. I live in Hollis with my wife and son. My son is 24 years old, has an autism, and so I'm personally invested in this. Should we have a committee? By all means, yes. Please support SB 408 to establish a committee to study the housing crisis for people with disabilities. My wife, people I know, I'm also a legislative liaison for Gateways Community Services. I lead a group of about 280 people with disabilities and their families. Okay, so I'm somewhat familiar from a broad spectrum point of view what people face in the developmental disability space. We are concerned. We're concerned about sustainable housing, and we're concerned about continuity of care. Okay, so what happens if you're in a house and then your care provider disappears? Okay, so let alone just having housing itself. So I attended the House hearing last week on HB 1168. I went in very optimistic with high hopes. I came out very concerned, and my concerns were the result of the questions that the legislators posed of the people giving testimony. And if I was to be very flippant, all right, and this is maybe flippant and unfair, I might lead myself to believe that, well, geez, the committee may come up with a solution of, say, let's slap a wheelchair ramp on a house and put some beds in there and turn it into a congregate setting. And and again, this may be unfair, but this was my perception from the hearing, is that there was a lot of presumption of solutions in there already. Okay, so people did not have an open mind. They seemed to have an idea of what the solution was. And my fear of a committee developed by that they would have to suffer from confirmation bias. They would seek out information that supported what their presumptive solutions were. And we don't want that. Okay, the disability space is large. It's huge, right? There's people with physical, hearing, and visual impairments. There's people with developmental disabilities, intellectual disabilities, and so on. There's no one-size-fits-all solution in this space. And even for a single disability, there's multiple solutions. And so what we want is solutions that give people a choice. We need multiple solutions to give people a choice. And even for my son, right, there's more than one solution for housing for him. In my written testimony that I submitted through email last night, I've given you all a list, an arm's length list of organizations and groups that you should refer to, or this new committee should refer to as subject matter experts. Okay, these are people that are composed of, the groups are composed of people with disabilities, and they represent people with disabilities, and they know what their problems are. They know what are the best solutions for them. Okay, and so I would urge that this committee, if it's formed, to refer to the community, learn from the people, go in with an open mind, don't presume solutions, listen, and come up with solutions. And the other thing I would say about this committee is it's to study the effects. I want to see output from this committee that results in legislature, policy change, and actions. I don't want to see a report. I want to see change happening. So please, thank you for the time. Please support SB 408.
Thank you, Will. And I would remind, what we do is we will put the committee together. There will be a report to the Speaker of the House according to the legislation. Speaker of the House, the Senate President, and then after that, they'll put in, if there's a recommendation, then there will be a bill put in. So
Thank you very much.
we're not the House.
Thank you.
Any questions from the committee? Seeing none. Thank you. Jan Lazard Patel.
Good morning.
Welcome.
Thank you for the opportunity to testify today. I am Jan Lessard Patel. I live in Candia, New Hampshire. The bill I'm testifying in support of is Senate Bill 408. Bill 408 is a first step in gathering current numbers of how many individuals, like my son Micah, are at risk of homelessness if something happens to their family member caretakers. I'm here representing a parent group that most people would not want to join. Parents who hope they live longer than our children because we fear for their care when we are no longer alive. I'm part of a parent group connected through the Moore Center who have been exploring housing options here and in other states with the goal of creating viable options for this highly vulnerable population. Having solid numbers for the upcoming need as well as a plan for New Hampshire to move forward is crucial for the future of our children. My 30-year-old son Micah has level 3 autism, also known as severe autism, which falls under the diagnosis of intellectual developmental disabilities, or IDD. In Micah's case, his diagnosis means he's nonverbal and needs one-on-one care every waking moment. I'm blessed that he's a gentle guy, but his impulsive actions, such as bolting away from caretakers and pica, meaning eating inedible objects, often places him and sometimes others at risk. His father died of cancer when Micah was age 14, and I am his only surviving parent. He does have siblings who will be there for him in the long run, but my hope is that they can fulfill the important sibling role with Micah once he's settled into a residence where he can age in place before I am too old to care for him. Micah currently lives at home and has a day program through the Moore Center. There are many families like mine doing their best to care for their adult children at home because supportive housing options are not available. New Hampshire has a few group homes and programs for adults with IDD, including enhanced family care, which is like an adult foster care program. These housing options only meet the needs of some individuals and are not long-term solutions because when the foster parents decide to end their caring role, the adults with IDD have to move to another home. Change is especially difficult for individuals with IDD. Even minor changes, like even wearing a new shirt, can be met with meltdowns, confusion, and self-injurious behaviors. Long-term, stable housing is a critical need for Micah, his peers, and for their families who just want to sustain their quality of life in New Hampshire. I'm asking that you please support this bill and support our efforts to provide for our children. Thank you for your time and consideration.
Thank you, Jan. Any questions from the committee? Seeing none. Lisa Bodwin.
Good morning. It's good to be back in this room. I wasn't here at all last year. For the record, my name is Lisa Bodwin. I am the Director of Strategies for Disability Equity. I ask you to please support SB 408, a bill to study the impact of the housing crisis on the disability community. Over the last 10 years of working with families and individuals living with disabilities, I have heard countless nightmares from families who lay awake at night wondering what will happen to their loved one after they're gone. And no doubt you will read testimony that's been submitted about these kinds of stories as you've heard today. You all know that I'm also a parent, so I have a ton of skin in this game. As Will said previously, there are many paths to home for people with disabilities. And we need to make sure that people with disabilities live alongside people without disabilities. In my capacity as a disability policy professional, I co-authored a disability housing report in 2021, which I will email to all of you. Based on an informal survey of New Hampshire's disability community, it revealed that there is this severe crisis in affordable housing and its disproportionate impact on people with intellectual and developmental disabilities is little discussed, as others have said. Among the many issues contributing to this problem, currently most adults with ID and DD live in their parents' home or with close family members. for their entire lives. One finding said that 60% of caretakers reported their own age to be between 55 and 74. This means a small tidal wave of housing needs is on the doorstep of New Hampshire. Because families continue to house their adults with intellectual and developmental disabilities and share homes with them, doesn't mean that they are obligated to, right? No parent is required to fund the housing of anyone who's over 18 years old. So that means that our developmental disability system is disproportionately on the backs of family members, and this is just one of the complicating problems. New Hampshire's DHHS and the nonprofit service provider system for this population, as I just said, inappropriately relies on parents. This deep structural flaw in the current system ignores the lifespan threat of housing instability and homelessness for individuals with intellectual and developmental disabilities. And as others have said, more broadly for all people with disabilities. And it is functionally not sustainable. I'll just remind you all that the Center for Medicaid and Medicare Services does not allow Medicaid waiver funding to supply funds for housing. And that's one of the realities that will come to light if there is a study committee on housing for the disability community. We all need to know the constellation of factors in New Hampshire that contribute to this overwhelming, very serious challenge. Parents carry the vast load of responsibility. A disability housing study committee can examine the statutory, regulatory, funding, and workforce components in that universe of how to meet the needs of the housing needs for people with disabilities, to then establish a priority list of actions that is appropriate for the New Hampshire legislature to take in playing its role in creating inclusive, appropriately supportive, affordable, accessible housing. People with disabilities, as you all have heard me say before, they want to be contributing tax-paying members of their home communities. SB 408 will help create a roadmap for the homes that they need to take their place in our beautiful Granite State. Thank you for your attention. I remain a resource and a subject matter expert at your disposal. Thank you.
Thank you, Laura. Any questions from the committee? Seeing none. We have three final speakers. Karen Ouellette. We have Karen, then Laura McIntosh, and Sylvia Dow. Those are the list that I have. She did? What do I know? We have two.
Thank you.
Welcome.
Thank you. Chairman Birdsall and committee members, thank you for your service and thank you for taking the time to listen to my testimony. My name is Karen Ouellette. I live in Hampton. I'm here to ask your support for SB 408. And I'm going to tell the story of my son. I'm the mother of a 34-year-old son with developmental disabilities. In the past year, he has had 3 different living situations, going from an apartment setting that became emotionally toxic to living in my house as there was no other option, and finally living in an enhanced family care setting. At the moment, this setting addresses his needs and he's very happy. It is a welcome relief, and I hope he is able to live there for many years. However, with enhanced family care, I could get a notice this afternoon that they will no longer be providing my son's care, and we will have 90 days to find other housing. Considering it took us over a year to find this placement, that most likely means a move back to my house. At some point, moving in with mom will no longer be feasible as I age and am less able to provide for his needs. I have no answer to where he will go to live at that point, and it terrifies me. My son wants a stable housing situation where he has the support he needs. For him, that means someone is available 24 hours a day for any needs that arise. He needs guidance and assistance with medication, meals, and exercise. It means having transportation to get out into the community for doctor's appointments and employments, especially his summer job at Prescott Park. He also needs transportation for recreation and, above all for him, trips to the theater so that he can pursue his passion of acting. I don't think these are unreasonable expectations. My son deserves a stable housing setting with appropriate supports and to have a say in what this setting might look like. As an aging, widowed parent, I deserve to know that my son will have stable housing long after I'm around. Isn't that something we both deserve? Housing for adults with developmental disabilities has been widely ignored by the state of New Hampshire. A committee to explore this issue would be a first step towards addressing the needs of my son and so many like him. I strongly encourage you to support SB 408. Thank you for your time.
Thank you, Karen. Any questions from the committee? Seeing none. Lori?
Thank you to the committee for hearing our testimony. I'm testifying in support of SB 408. My name's Lori McIntosh, and I'm a resident of Dover, New Hampshire. I'm the parent of 2 adult children with intellectual developmental disabilities who are in their 30s. I'm 65 years old, and I feel a great pressure to find appropriate supportive housing for my sons before I'm too old to provide the care that they need. I've joined with other parents to create Our Place New Hampshire, which is a nonprofit with a mission to provide supportive housing for adults with IDD. We have 60 families on our list, as someone already said, hoping to get their loved ones into one of our projects. We have listened to the families and found that many of the adults with IDD want to live with their friends in a place like a family. They require support to be successful. In a setting with a number of people with IDD, it is possible to share staff for certain activities, which is much more cost effective. For instance, sharing overnight staff allows people to have the help they need, but tenants are sharing the cost of the support. The other advantage of having people live near their friends is that they can socialize and share meals together. Most of us would rather not spend the rest of our lives eating dinner alone every night. In the 5 years since we began this project, the rules and regulations have toughened and tightened, making our task even harder. Our Place New Hampshire plans to build a home with 9 apartment units for adults with IDD, plus a common kitchen, living, dining room where tenants can socialize. The home would have staff to provide support to tenants, including help with daily living skills, accessing the community, recreation activities, vocational support, and transportation. When we started this project, a building with apartments like this required certification. Now we are required to be licensed, like a medical facility. Licensing increases our cost to make the project much less sustainable. Paperwork requirements for a licensed facility can cause an increased need for staff, and building requirements increase the cost of construction. The state could be making this easier, not harder. We are working with a developer from out of state with a proven track record for building successful, sustainable workforce housing with 40 to 50 units with 25% reserved for adults with IDD. This is a beautifully integrated model where tenants with and without disabilities have apartments next to each other. All of the tenants can gather in a common area for facilitated activities. There are 24/7 staff with the same types of support offered in our self-contained model. Tenants with IDD are fully integrated into the community. Licensing rules in New Hampshire may make it difficult for this project to succeed since they were not written for this type of integrated project. Once again, licensing requirements can make the building more expensive to build, requiring the same level of specification as a hospital, with things like an elevator that's big enough to hold a gurney or toilets that can support an 800-pound person. Hopefully, this study committee will pave the way for the necessary changes in the rules and regulations for this type of housing so that it will be a safe and well-run but not ridiculously expensive. Thank you for allowing me to share this with you.
Thank you, Lori. Any questions from the committee?
No, not yet.
So we have two, Laura McIntyre and Alex Katrubis, supporting, not speaking. Is there anyone here that would like to speak that wasn't given the opportunity on Senate Bill 408? With that, I will close the hearing. Is everybody in agreement? Senator Prentice, are you okay with going into exec? 'Cause I think Senator Whitley, you have the next bill. Okay, so,
I'll move on to pass.
on 408, wait. All those in favor of moving into exec, say aye. Aye. Opposed?
Move on to pass.
Second.
Okay,
But I want one amendment, and that would be to reduce the,
Senator Brown,
one amendment, that would be to reduce the number of senators to 2.
correct,
Second that.
yes. It makes it an
What about the House?
odd number.
The House has 3. We want to
Or
reduce.
3, so it should go to 2.
Yeah, but the House, doesn't the House have?
House
three?
does.
It has 3.
Yeah, they need a little more oversight.
Okay.
And plus it leaves an uneven number for voting purposes.
Okay.
A
So,
lot to pass as amended.
What?
Madam Chair, I'm wondering if the bill sponsor would be interested in adding a duty to the study committee. Currently, the duties only include studying the impacts. I'm wondering if we also want to add a duty about, coming up with potential legislation or coming up with potential solutions. Perhaps we would want to add a duty.
I think the point of the study committee is to study it and come up with a solution. Oh, sorry. Okay, sorry.
For those of you that are not involved in this, could you please shut the door? Thank you.
Okay,
There is a report called for in section 6.
Yes.
So I think normally a report from a study committee like that would recommend
Yeah.
legislation.
Yes, that's what I was going to say. I think it's covered.
Okay.
Okay.
Great.
Thank you.
All right, so we have a committee amendment that decreases the number of senators to 2, maintains the 3 members of the House.
And I move on to pass as amended.
So we need to vote on the amendment first.
Right.
We did. Oh, I move the amendment.
The amendment was moved and seconded. We just need to vote on the amendment.
All those in favor of the committee amendment, say aye.
Aye.
Opposed?
Move on to pass as amended.
Second.
All those in favor of ought to pass as amended, say aye.
Aye.
Move consent.
Opposed?
Second.
Consent.
All those in favor of consent, say aye.
Aye.
Opposed? And Senator Abar, would you like to take this out?
Love to.
All right,
Thank you, everyone.
all right.
Motion
All
to move
those in
out of
favor?
exec-
Thank you. Motion made to get out of consent. Do I hear a second?
Consent?
Sec, that too.
Oh, this day is gonna go well.
Yes.
All those in favor of moving out of exec, say aye.
Aye.
Opposed? All right, I will open the hearing on Senate Bill 349 and welcome the prime sponsor, Senator Whitley. Oh, sorry. Can you just,
Thank you, Madam Chair.
sure, hold on a couple minutes. Oops. You ready? All right, Senator Whitley.
Thank you, Madam Chair. Good morning, members of the committee. For the record, my name is Becky Whitley, and I'm honored to serve Senate District 15, which includes the wonderful communities of Bow, Concord, Pennacook, and Hopkinton. This morning, I'm proud to present Senate Bill 349 for your consideration. This may look very familiar to the committee. This was a portion of the New Hampshire Momnibus that we passed unanimously and then tabled last year for inclusion of the budget. However, this portion of the Momnibus got lost in the shuffle and didn't make it into HB2. So very simply, this bill simply adds a duty to the existing Wellness and Primary Prevention Council that was created by this legislature many years ago. Just for full disclosure, I am a member of the WPPC, and I think it's a very effective body at identifying barriers and gaps in our current prevention system, and creating ways or coming up with ways to better serve our families. So this bill would just add a duty to the WPPC, asking them to study how New Hampshire can reduce barriers, improve access, and create a system of voluntary universal access to home visiting programs. So this committee may know well that evidence-based maternal, infant, and early childhood home visiting has been proven to change lives for years to come. It's also been shown to pay for itself financially over time and reduce health, education, and criminal justice costs. So this legislature has worked in a bipartisan way to expand access to home visiting in the Medicaid program, but currently individuals in the Medicaid program are really the only ones that have access to reliable home visiting. It was a personal issue for me as well. I had the benefit of access to home visiting when I had my son, and it was really such a critical component to getting both care for myself and for my son. So it's a very effective evidence-based practice that a lot of other moms would benefit from. So I respectfully ask the committee to support SB 349, and I'm happy to take any questions.
Any questions from the committee? Seeing none?
How'd this get dropped?
I don't know, Senator Bradley, that's a very good question. In the shuffle. I wasn't,
Sorry about that.
I wasn't doing my job.
No, I think maybe I wasn't doing mine.
Don't announce that. Any questions from the committee? Seeing none.
Thank you.
Senator Whitley. Rebecca Witkowski?
Good morning, honorable committee members. My name is Rebecca Wojkowski, and I am the Child and Family Policy Director at New Futures. But today I'm here before you as the chair of the Wellness and Primary Prevention Council. As the chair, I'm here to emphasize our deep support for Senate Bill 349. As a little bit of history, the WPPC was enacted in 1995 and has served this legislature in this state for 29 years. The goal of the WPPC is to provide recommendations and support to create a strong primary prevention system in New Hampshire. And this is really done in true coordination with partners at DHHS, stakeholders within the field, and the legislature. The WPPC is really primed to take on the directive that's outlined in Senate Bill 349 and has done so before. So in 2017, a piece of legislation with a similar objective was filed and passed, which directed the Wellness and Primary Prevention Council to look at the Family Resource Center of Quality designation and make recommendations on how to create a more sustainable infrastructure system of family resource centers and leverage state and federal funding. Flash forward to 2023, this legislature, through bipartisan support, funded this system with historic levels of funding, which means more families are getting services, family resource centers are supported, and overall, a stronger system of primary prevention has been built in New Hampshire. Given that, I believe that the Wellness and Primary Prevention Council can tackle this, and it would be a great opportunity for us to examine how we can really improve access to home visiting for families in New Hampshire, because we know there's a great need. I'm happy to answer any questions. I also just provided for reference, the WPPC does issue annual reports. I have a copy of one, and the previous legislation from 2017 for reference, that this is in line with the duties and recommendations that the WPPC can make. Thank you. I'm happy to answer any questions.
Any questions from the committee?
Thank you. Thank you.
Seeing none, thank you. Brianna? Welcome.
Hi. Hi, my name is Brianna Hinkle. I'm the Legal Policy Fellow at New Futures. New Futures is a nonpartisan nonprofit organization that works to solve New Hampshire's problems through policy change. New Futures supports SB 349 because it works towards access to home visiting services by having the Wellness and Primary Prevention Council conduct a study. Home visiting is an evidence-based model where a healthcare provider goes to families' homes after they give birth and before birth. It helps families develop skills such as increasing vocabulary, and it also helps helps the parents by screening for postpartum depression. Currently, New Hampshire has a home visiting program, but only 7.2 of the families that qualify for it actually have it, like go through the program. So this study will create more access for more people to have access to it. Thank you.
Thank you, Brianna. Any questions from the committee? See none. That is actually our last speaker. We have Lisa Bodwin here, who is in support but not speaking, and Pamela Kelly from the New Hampshire Coalition Against Domestic and Sexual Violence, supporting and not speaking. Is there anyone here that would like to speak on Senate Bill 349 but was not given the opportunity? With that, I will close the hearing on Senate Bill 349. Sure.
I move exec session. I move ought to pass on Senate Bill 349.
Second.
Okay, the motion from Senator Bradley was ought to pass, and Senator Avard seconded it. Any discussion? All those in favor of ought to pass, say aye.
Aye.
Opposed?
Consent?
Second.
All those in favor of consent, say aye.
Aye.
Opposed? Senator Whitley, would you like to take this
I would
on?
love to. Many thanks to the committee.
Move on out of exec.
Second.
All those in favor of moving out of exec, say aye.
Aye.
Opposed? We are out of exec. Hearing on Senate Bill 557, and welcome the prime sponsor, Senator Prentice.
Thank you, Senator Birdsall and members of Senate HHS. For the record, my name is Sue Prentice, State Senator, District 5, representing a large part of Grafton County, some wonderful communities in Sullivan County, and one in Merrimack, the wonderful town of New London. I am here today to introduce Senate Bill 557, which prohibits discriminatory actions against entities participating in the 340B drug pricing program. So according to the American Hospital Association, for more than 30 years, 340B drug pricing program has provided financial help to hospitals that are serving vulnerable communities to help manage rising prescription drug costs. So we're talking about hospitals in these vulnerable communities. We're talking about rural referral centers that are rather busy, like would be our own Dartmouth Health. We talk about community access hospitals. We think about federally qualified health centers. So with that in mind, 340B is part of the Public Health Service Act that requires pharmaceutical manufacturers participating in Medicaid to sell outpatient drugs at discounted prices to healthcare organizations that care for many uninsured and low-income patients. And I've already named the different types of organizations and federal grantee organizations, as well as care settings that are included in this program. 340B hospitals to stretch limited federal resources to reduce the price of outpatient pharmaceuticals for patients. They use these limited federal resources to reduce these prices and expand health services to the patients and communities that they serve. Hospitals use 340B savings to provide, for example, free care for uninsured patients, free vaccines, provide services in mental health clinics, and implement medication management and community health programs. So according to HRSA, which is our Health Resources and Services Administration, which is responsible for administering this program, enrolled hospitals, which are covered entities, can achieve an average of somewhere between 25 and 30% in pharmaceutical savings and pharmaceutical purchases. Despite oversight from HRSA, the program's proven record of decreasing government spending and expanding access for patient care, there is some moves or have been some moves that are captured or the word is used discriminatory or words, practices to scale this program back and to reduce the benefits. That's what we don't want to do. So this is a preemptive, very limited in scope piece of legislation to prohibit this type of what could be a discriminatory action. So I'm happy to take any questions you have. This has been done in at least Connecticut, Iowa, Louisiana, and Nevada. I have technical experts that are much better talking about 340B than I am, but I understand this. A great example to give is if you are from another part of the state and you come down to receive care, say at the hospital in my hometown, Mary Hitchcock or Dartmouth Health, and there's a prescription that is written for you, you could get it there, but you should be able to get it back in the community you go to. And if they are not, they could potentially not get it if they're discriminated against and not offered the pricing that is covered in this program. So that will be further explained by folks behind me, but that's the way to see it. Or at least that's an example of what we're trying to protect is you come down, you get your care, you go home, it should be the same. You shouldn't have to travel back to that particular location or pharmacy to get this price. Thank you.
Thank you, Senator. Any questions from the committee? Okay. Thank you.
Thank you.
Representative Mary Hawkins Phillips.
Thank you and good morning, committee. For the record, my name is Representative Mary Hacken Phillips, and I serve Grafton County District 12, which is the towns of Hanover and Lyme. So my presence here today before this committee is to just let you know that there's a willing partner on the other side of the wall, as we like to say, who understands the importance, the critical importance of this bill, and is proud to serve as a conduit to usher this through the process. Also, I mean, I just think that this is such an important piece of healthcare access in our state, particularly in our region in the Upper Valley, and that I know, folks across the state seek their care in our neighborhood. So, it's my pleasure and duty to be able to serve the state and to make sure that, this really important protection is ushered through the process. So that's it. That's why I'm here, and I'm happy to take your questions.
Thank you, Representative. Any questions from the committee? Seeing none. Christine Stoddard. Welcome.
Too short for this microphone. Yes. Good morning. For the record, my name is Christine Stoddard, and I am the Director of Public Policy at Bi-State Primary Care Association. We represent community health centers across New Hampshire and Vermont, and we are also a nonprofit that advocates to expand access to preventive care for all New Hampshire and Vermont residents. Our members include some of the healthcare organizations that Senator Prentice mentioned, including federally qualified health centers and community health centers. Those 11 health centers have 87 sites across the state of New Hampshire, which makes programs like 340B and their ability to have contract pharmacies provide care to their patients very, very important. Across the nation, approximately 90% of health center patients live at or below 200% of the federal poverty level, which is about $62,000 for a family of four. We ask for your support of Senate Bill 557 because it expands access to prescription medicine, but also access to care for the reasons that Senator Prentice mentioned. As she said, the program was established in 1992 by Congress in the Public Health Services Act. It allows qualifying organizations, including community health centers and the hospitals, to purchase drugs at reduced prices. So in exchange for drug manufacturers being able to participate in the Medicaid program, they have to offer our health centers discounted drugs or prescription medicines at a discounted price. And I'll try and give examples of how this works in a real life transaction. The congressional intent of this program is to allow our health centers and hospitals to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. And as I mentioned, we have 87 sites in New Hampshire. So using a real life example, and Ed Shanshala can expand on this from Ammonoosuc Community Health Services. We have health centers that have multiple sites. Ed's Health Center has 5. They contract with retail pharmacies throughout their service area to fill what are called their 340B prescriptions. So a health center patient is prescribed a medicine. They don't know that it's called a 340B drug. They go to their local retail pharmacy to pick up the medicine. That retail pharmacy has negotiated a contract with our health center to sell that their 340B prescriptions to their patients. So the health center patient will fill their prescription at the retail pharmacy. Their insurance company will then reimburse the health center for that drug. And the health center takes the savings that's earned, the discounted purchase price, and the savings that they get from the insurance company's reimbursement. They take that savings and then they reinvest it into their services that they offer at the community health center. Some health centers also offer their patients sliding fee discounts on prescription medicine. So a health center patient could access a very expensive cholesterol medicine for $5 versus the $100 that a patient might have to pay out of pocket. So it benefits both the patient directly and the community health center. Providing access to a full range of affordable comprehensive healthcare services, including pharmacy, is a key component of the community health center model. They are required by federal law and regulation and all of their missions to ensure that the savings that they receive from purchasing these discounted medicines be reinvested into the health center programs and their services. Each community health center uses the savings to the greatest of their ability to meet the unmet needs of their patients and their communities. And one of the unique things about federally qualified health centers is that they all have patient majority boards. So their boards direct the services that they provide in order to meet the needs that patients have identified. And the 340B program allows them to accomplish this. In 2022, for example, New Hampshire's health centers received just over $14 million in 340B savings. That accounts for 20% of their patient services revenue. So when we have insurers and other people involved in the process or companies involved in the process that are trying to take the savings from the community health centers, that reduces their revenue and it reduces their ability to provide services to your communities. And it also reduces patients' access to care because they then have to find their prescriptions elsewhere and they could possibly be more expensive. So we would ask that you support Senate Bill 557. And I should also mention that this is a federal program, right? But we have been asking Congress to fix these issues for a number of years, and they haven't been able to get to a point to make that happen. And so that's why we're asking you as our state legislature to step in and help us help our communities and your constituents. So I do have patient examples that I've included in my testimony, but I did want to give my time, because I know you all are busy, to the people that actually serve patients so that you could hear directly from them how important 340B is to their patients. But I'm happy to answer any questions also if you have them.
Thank you, Christine. Any questions from the committee? Seeing none.
Thank you.
Ed?
It's been a while since COVID.
Thank you, Senator Prentice and the committee for taking up this bill. Being handed out is my testimony, and then report to our community. It gives you some context of Ammonoosuc Community Health Services. As Christine said, we are a federally qualified health center since 1994. We have 5 care delivery sites in Whitefield and Franconia, Littleton, Woodsville, and Warren. It's 26 towns, it's 30,000 residents, and we see roughly 1 in 3 of our friends, family, and neighbors. So when we look at the 340B program, Christine's accurate in that we take the savings and we reinvest it in 3 particular areas. One is affordable medications. Historically, we're able to do that through an in-house pharmacy in Littleton, and then through contracts with pharmacies as close as possible to patients who need to get their medications. And since 2017 is when you look at the second, there's a graph that you can see the erosion in the savings. That is, it's in the 70s%. I mean, we're looking, and you can look and see in human terms the impact of these dollars in fewer visits, fewer patients. So it's in the affordable medications. It also addresses those challenges our neighbors experience in determinants of health. Oftentimes it's transportation, and especially in a rural area, even though there is some public transportation, it might not be the time you want, going where you want, when you want. So it's hit or miss. And then the last area we invested was in oral health. And when we had our oral health program, we were serving over 1,000 patients, and sadly we were pulling about 1,200 teeth per year. So over the course of this erosion, we had to shutter our in-house pharmacy, or it would put the entire institution at risk financially. We did it elegantly in standing up a meds to beds program at Littleton Regional Hospital, where you leave with your medications, and we timed the closure of our facility with the opening of theirs, so nobody lost a job. What we're seeing that could be construed as discriminatory and or a violation of Federal Trade Commission free trade is we're being restricted to fewer pharmacies. And it's not one pharmacy per site, it's one pharmacy for our tax ID number. So if we think about our health center in Warren, and we use Walmart's, for instance, as a place for people with sliding fee scale to get their meds, there's one in Plymouth, Woodsville, and Littleton. Which one do I open? Which one do I close? So those are restrictions. So the erosion economically is significant. The impact on patient access to medications is exacerbated. When we think about medications, and I had the privilege to co-lead a national pharmacy collaborative, 4% of adverse drug events, not taking your med is an adverse drug event, results in a hospitalization at an average of 10 plus or minus 2 days. A hospital day in New Hampshire is about 2,000 ICUs, 10 ED 750. So there is a shifting to a more acute, higher cost center that is unnecessary when someone takes their medications for congestive heart failure or for hypertension or for diabetes. They will not need the ED because their chronic condition is in control. And if they can't access their meds because of transportation issue, affordability, we end up shifting to a patient experience that is clearly not optimal, quality outcomes that are questionable at a much higher cost. So those are some of the challenges that we experience. So I'm pleased that you've taken this up. I thank you. I've been saying this since 2017. I feel as though the voice of the patient is finally being heard, so I'm grateful. To the degree to which I can be helpful to you, I will always come to Concord, roll my sleeves up, sit at the table, and work with you to the benefit of the residents of New Hampshire. We keep them healthy. They're your constituents. When they're healthy, they participate in life, including small businesses, and they're a significant economic driver. So more than willing to field any questions you might have now or in the future.
Thank you, Ed. Any questions from the committee? No? Seeing
Thank
none.
you.
Thank
Grateful.
you. Matthew, Welcome. Absolutely. What?
These chairs are so.
Are they really? Welcome.
Thank you, Madam Chair, members of the committee. For the record, my name is Matthew Hood, Vice President of Government Relations at Dartmouth Health, and I have my colleague Kristen Chupko here with us, who is the manager of the Dartmouth Health 340B program.
Thank you, Madam Chair and members of the committee. I can't tell you how grateful I am that this is here in front of you today. I'm a licensed pharmacist. I've been practicing since 2004. I'm licensed in New Hampshire and in the state of Maine. And I can't tell you that anything has been more rewarding than being involved in 340B. I have been in 340B since 2013, and in that time I worked for a small covered entity health system in Maine who was able to use 340B to benefit patients, as you've kind of heard some of the FQHCs speak about. I don't want to belabor repeating a lot of the things that you've already heard, but I think the most important thing to take away is that the 340B program is here to stretch scarce federal resources as far as possible, reaching more eligible patients and providing more comprehensive services. And I can't stress that phrase enough, because this is what it does. This is what it allows covered entities to do. And it's been under attack really since 2020, and it's gotten more restrictive and more restrictive for covered entities to be able to use contract pharmacies. I think one of the most important things to understand about that is when the 340B statute was passed in 1992, the pharmacy landscape was very different. It didn't have PBMs and vertically integrated health care systems, and patients did have a little bit more freedom in where they wanted to go, and medication costs were a little bit less expensive than they are today. But what I really want to, urge is that, the Federal Register had some guidance passed by HRSA in 1996 and 2010, really stressing that the intent and allowance of contract pharmacy really falled in line with the intent of the statute. And that's what's being debated and is under litigation today. In one of the phrases in the guidance, they emphasized that the covered entity is responsible to maintain this relationship with the contract pharmacies and ensure that they are holding that statute to all the particular nuances that is oversight, and we are subject to audit. And so if there's any concerns that the program is not being managed correctly, that's for HRSA to decide, and not by anyone else who is coming to take the benefit away from covered entities to be able to use those scarce federal resources. So I really hope that, with that being said, this is so necessary. And as it was already testified to today, the federal government hasn't been able to take action, and it has been going on for years. And 2023 was the biggest impact to the contract pharmacy, and them taking away the ability for us to be able to have our patients and share that savings to bring back. Today, 29 states have taken measures since 2019 to support 340B, and 8 of those in 2023 have enacted contract pharmacy legislation. So I really am hopeful that we can support this going forward to protect our covered entities and what they do for the patients in the state of New Hampshire. So let me focus a little bit on that. So patients have the right to choose, right? We want to be able to choose where we get our health care from, whether it's our physicians and our medications and therapy, whatever it is that you're seeking care for. Some of our patients at Dartmouth Health do choose to use our retail and specialty mail order pharmacies, which is great because that's not being restricted right now. But that's not feasible for all patients to drive 2 hours to get medication on site. Dartmouth Hitchcock Pharmacy at Centera is 24 hours. And currently, with a lot of the pharmacy closures, they are seeing an influx of more and more patients to deliver pharmaceutical care. But some patients don't have the ability for transport. So this is not necessarily an option. They want to use their local pharmacy. They want to be closer to home. Some of those patients even may choose to use a mail order facility. But something to stress here is that there are requirements for certain insurances that they are mandated, meaning you have to use this pharmacy. And I can tell you that our patients are receiving prescriptions from specialty pharmacies across the country in the state of California, Indiana, Arizona, very far from their home because they are told that the medication will not be covered unless you go to these pharmacies. And so that's really important to maintain the contract pharmacy ability for our covered entity to say that these pharmacies that are out of our state are caring for our patients. And if we're not able to capture 340B savings at those pharmacies, then we're really limited in what we can provide back to our communities. So our retail pharmacy does provide a medication list and provides some life-saving therapies at very low prices. I want to call out Eliquis. It's a blood thinner, very commonly prescribed. Anyone, I could have my father come from New York and go to Dartmouth Hitchcock Pharmacy and pay no more than $75 for that medication. Most patients are paying hundreds of dollars. It costs over $400 cash if you did not have insurance coverage. That is for all. That is not just for Dartmouth Health patients. And so that list and those medications are funded by the 340B program, which I think is incredibly impactful, especially considering that that will help avoid readmittance to the hospital, which, if you can imagine being in the hospital 3 or 4 days and then you have to come back because you can't afford your life-saving therapy, it's definitely needed for our communities and our patients. So some of the other ways that we use the 340B savings outside of providing charity care, outside of filling the gaps for uncompensated care, we have a hemophilia treatment center that supports over 200 patients, and they are supporting those patients with life-saving therapies, and the length of life in hemophilia has grown tremendously in the last 25 years. And so the benefits that they are able to provide because of 340B include nurse managed care coordination, community education, support for youth and adolescent in self-management skills, and mental health support, all really important additions to supporting your disease. Additionally, we support treatment of over 1,000 patients living with HIV as the only Ryan White grantee holder in the state of New Hampshire. The other benefits that the Ryan White program with the 340B benefit helps to support is multiple service locations. We have Bedford, we're trying to open in Keene, there's Lebanon, there's Manchester. And they are using the 340B to help with continued expansion of PrEP support for patients getting prophylaxis treatment. They support a community health worker to participate in the care of patients suffering from drug addiction. And they also supply emergency funding for patients under the grant if they have emergency medical need services, so services they can't afford, and supplementing that charity care. Another thing that Dartmouth has done is funded a Dartmouth Cancer Food Center Bank with the 340B revenue and savings. Also, grants directly from Dartmouth to local businesses supporting housing growth for those who are homeless, adults with developmental disabilities, and transition homes. We also operate the Mary Hitchcock Addiction Treatment Program for those with opioid use disorder. And we've opened new service lines, and I'll call out New London Hospital opening an express care service line to help support urgent needs in that community. So in conclusion, it's vital that we continue to maintain contract pharmacy and urge the state to support this initiative to maintain the care for our patients since we are unable to do so at the federal level. And while we use our retail pharmacies to support patients' health, we are unable to care for everyone, mostly because of some of these mandates or wherever their proximate location is and travel distance to be able to get to a pharmacy or a healthcare provider. We really do hope that that you see this as important as I do, and it has been rewarding to be a part of this program. I thank you for the opportunity to speak on 340B and welcome any questions.
Thank you, Chris. Any questions? Seeing none?
Thank you.
That was the last speaker that I have. Is there anyone here that would like to speak on Senate Bill 557 that was not given the opportunity? With that, I will close the hearing on 557. I know I want to get into exec session, but do we want to take about a 10 or 15-minute break?
Wow.
Okay, 5. 5-minute break. All right, we are in recess for 5 minutes. Okay, do I hear a motion to go into exec?
So moved.
All right. All those in favor of going into exec, say aye.
Aye.
Opposed? All right,
Why don't we do this the last year first, because all these people are still here.
okay, so why don't we do 557?
I'll move on to pass.
Ready? All right, Senator Bradley moved on to pass, Senator Whitley, second. All those in favor of ought to pass on 557, say aye.
Aye.
Opposed?
Second.
All those in favor of consent, say aye.
Aye.
Opposed? Senator Prentice, would you like to take this one out?
Love to, sir. See how many people we can clear out.
You're welcome. All right, why don't we go with Senate Bill 312, which was the third-party liability. That was my bill that the HHS wanted.
Second.
Any discussion? All right, all those in favor of ought to pass on 312, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
Aye.
Opposed? And I will take this one out.
And Avar's gonna start singing.
Yeah, I know. Watch out. Watch
All right,
Pretty soon he will.
401, Jeb, do you, Senator Bradley, do you have a? motion?
Yes, I'll move ITL. Unless there is a consensus of interim study
Let's.
that would everybody would support.
I don't think I could support an interim study, but thank you.
So do we want ITL or interim study?
Second idea.
If there was no debate on interim study, I guess I could support that. I know you can't speak for the sponsor.
Yeah.
All right, I'll take back my motion, go with interim study.
Take back your
No. I take back mine.
All right, so we'll move interim study. And
Second.
second.
And I would just say, having really sort of been, I don't know, the great, four-time grandfather of Medicaid expansion over the years, 4 times authorization. It's really valuable, more than as valuable, well, not as valuable as the program, but what is as valuable to keeping the program alive and well is the fact that we've been able to build a bipartisan consensus for it. I think it's unfortunate that after a lot of people stretched last year to get from no program reauthorization to then 2 years to then 7, I hate to see that consensus blown up. So
And
that's-
I would also add that I have spoken with Health and Human Services, and they do not want to, they want to keep it at 7 years right now. That's what they're building it up on. So I'm obviously going to support the interim study, so. Any other?
May I request a 1-minute recess? I apologize.
Sure.
Thank you.
You want to finish voting on it first?
No. Move back into exec. Senator Aguilar seconds. All those in favor say aye.
Aye.
Opposed? Any more discussion?
Consent?
We haven't voted yet.
Oh, I thought you just voted on.
We
Oh.
just vote on interim study?
We did.
That's what I thought.
Okay, everyone,
Getting that.
I said exec, move back into exec.
Oh.
Oh. I think we all just voted on different things then.
We already voted on that.
So we're in exec. A motion of interim study has been made and seconded.
Okay.
Any discussion? All those in favor of interim study say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent on 401 say aye.
Aye.
Opposed? I'll take it out. Next, 402. And this is mine too. This allows pharmacists to administer FDA-approved vaccines without explicit approval from the general court, as long as they're FDA approved.
And you had
I
an amendment.
I believe the amendment is 0729S. And Cam fixed it.
Okay.
So. Any,
692?
No, it's
Seven.
0729S.
yes. That was my flawed amendment. Oh, here, I got two.
Okay, thank you.
Madam Chair?
Yep.
So just to confirm, 729S is the amendment that ensures we are including influenza and COVID-19 and that
Yes.
addressed folks'
Yes.
concerns. Okay, great.
Any
Ought
discussion?
to pass on the amendment.
All those in favor of, ought to pass on amendment 029S, say aye.
Aye.
Opposed? Move ought to pass as amended on Senate Bill 402. All those in favor as amended?
I need a second on your.
Oh,
Second.
Prentice seconds. All those in favor say aye.
Aye.
Opposed?
Consent.
Second. All those in favor of consent say aye.
Aye.
Opposed? And I will take that out. We're holding 403, holding 406.
Just on 411, while we're here, I've heard it from one source at least that the Department of Insurance has put out a draft bulletin that seemed to look good from one of the advocates for the bills, so I think we should continue to hold, but that's good progress from what I've heard.
And I've heard the same.
As have I. So, okay, we're,
Stories are all
that was, I'm sorry.
And I just wanted to thank the stakeholders. They've been meeting a lot. It's a complicated issue, a lot of folks at the table, and so I appreciate all the work being done on this important issue.
Okay. Senate Bill 412, relative to residential care and health facility licensing.
Ought to pass.
I'll second. Any discussion?
We don't have an amendment.
There, I don't believe there's an amendment on 412. No discussion.
Cedar Crest.
Oh, yeah, this is the Cedar Crest one. All those in favor of ought to pass on Senate Bill 412, say aye.
Aye.
Opposed?
Consent.
Second. All those in favor of consent, say aye.
Aye.
Senator Abar, do you want to take this one out? Four, five, five.
So we have multiple amendments. Yeah. Or no, 455.
455.
We just have one, correct?
Six,
We
eight,
just have-
nine S, right?
0689.
I move
Yes.
ought to pass.
I'll second that. So
All those in favor?
Oh, I think she needs to introduce her amendment.
We have an amendment?
wait a minute.
Yeah.
Go ahead.
I just wanted, so this, based on the feedback that we had, I worked with Director Lippman and we did a stepwise increase. So right now we're at 80% for orthotics and prosthetics. What was presented in the introduced bill was 100, so we went to 90. So the general fund amount at 90 is 620,000. Okay, versus coming in all at 1.2 million. So doing it and then coming back and revisiting it, and hopefully next year to move to 100%. That was what I understood from leaving this committee hearing, was moving this in a stepwise fashion. So we're at 80, currently at 80, making the move to 90.
I'll second your amendment.
So the fiscal note has a 1.2.
That's at 100%.
That's at 100%.
Right.
So your
There's
amendment
a
drops it to 620.
Correct, that's it, yeah.
And that would be a FY '25 expenditure, so in
Correct.
this budget.
Yes.
You all set? Okay, all those in favor of amendment 0689S, say aye.
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 Opposed?
I move ought to pass as amended.
I'll second. All those in favor of ought to pass as amended on 455, say aye.
Aye.
Opposed?
Consent?
I'll second. All those in favor of consent, say aye.
Aye.
Opposed? Senator Prentice, would you like to take this one out?
I would love to. Thank you, Senator Bertzel. I feel bad for Jessica always having to manage this folder. It's terrible.
All right. Next one is 456, nurse retention program, and we do have an amendment on this one.
We have lots of the different amendments on this one.
I think
I'll move ought to pass, and if I can introduce amendment
I'll second.
736.
Okay.
And I'll second the amendment.
So if I could just speak to the amendment, I think we have heard just an awful lot of testimony about the importance of trying to incentivize nurses to get educated in New Hampshire, live in New Hampshire, stay in New Hampshire, work in underserved areas, work in our largest hospitals. But I think we've also heard testimony that standing this program up, even if we only put a small amount of money into it, would be pretty expensive. So what Senator Birdsall and myself are proposing is that we add $300,000 in this budget to the SLRP program dedicated to nursing professionals. It would be non-lapsing. And so the SLRP program is targeted toward underserved areas. They can be in Coos County, but they can also be in Hillsborough County. It just depends on designation of underserved. So it is not necessarily statewide, but it should incorporate the areas that are underserved. The SLRP is an existing program, so even though this is not a lot of dollars, it should be helpful, okay? The second, I think, is a way of getting to what Senator Gannon and probably all of us want to see happen, is that we're asking in section 2, the department to come forward with a report on how to expand what is already in SLURP and with this additional 300K, and incorporate that into their budget proposal for loan forgiveness for those nurses that don't qualify for this. And I think that that'll be a more efficient, faster way, especially with a, requirement to include a budget proposal, than doing the fund the way that Senator Gannon has proposed.
Any more discussion? Where are we?
Amendment 0736S was made and seconded. So we
All
gotta
those
vote
in
on.
favor of Amendment 0736S, say aye.
Aye.
Opposed?
About to pass as amended.
I'll second. All those in favor, any discussion? All those in favor of Senate Bill ought to pass as amended on Senate Bill 456, say aye.
Aye.
Opposed?
Consent?
Second. All those in favor of consent, say aye.
Aye.
Opposed? I'll take this one out. Four, five, seven.
I'll move interim study, and if I could speak to that.
Second.
Okay, discussion?
So I think we heard compelling testimony on both sides of the issue. I think what strikes me is that the insurance department in their testimony talked about the difficulty in creating a one-size-fits-all type of regulation. And I'm concerned, after having heard the testimony, of not having any review for 30 days and not being able to utilize the step-down approach that I think should be used. I think what is probably necessary is for Senator Gannon as the sponsor to work with all of the parties to try to find a compromise that can come forward in a future legislative year.
All right, so right now we have, I'm sorry? Okay, so any other discussion? All those in favor of interim study say aye.
Aye.
Opposed?
Consent?
Second. All those in favor of consent say aye.
Aye.
Opposed? And Senator Whitley, would you like to take this one out?
Jeb writes it for me.
Uh, 458.
Yes, I move ought to pass. And I'd like to propose a committee amendment.
Oh, this is yours. Okay.
On line 4, instead of 90 days, just changing it to 60.
Okay,
And then
you,
the last,
wait, you moved
ought to pass.
to pass. Was there a second?
No.
I'll second.
And committee amendment to change on line 4, 60 days, a 60-day supply, basically.
Discussion?
I prefer 90, but
No, I'm good with the change in the days, but if I'm correct about this, this would change who was dispensing in facilities at different hours, correct?
I believe so, yes.
Okay, so here's what I want to say about this, is that I've actually, worked the midnight shift in an emergency department where we had to dispense. And so you're getting a written order and you're then having to transcribe that order onto this label and to make sure you get the right milligrams in, whatever form is being, it's being prescribed into the right container with all of the right directions. And it's not that our healthcare providers aren't like super smart, but we scaled back on that. I worked in an emergency department, primarily the midnight shift, for 10 years. And we scaled back on what we were dispensing overnight to things that were either prepackaged or couldn't be dispensed because it was not always a perfect situation. The risk for error was high when, again, you're going through all of those steps. And that was part of like the 90-day piece. I'm all about changing that, but I'm worried about not that we don't have great healthcare providers, but are we shifting this responsibility into a place where it could become problematic?
Well, my question then, based on your information, how many of these are going to be done overnight? Probably not very many.
Well, I was using that as an example, is that it could be any point in time, but there are places that would become pharmacies that aren't normally pharmacies. Like that from a dispensing point of view is what I stuck out in my mind at this. So I use the midnight shift as an example, but I think it could be any hour of the day is what I understand this, what I understand this to be. But I also, I'm stuck. So this is the tough part, because a constituent of mine who's a former legislator, Biddy Irwin, wants us to do this. And the impact this has on cancer patients is like super important. So
And, especially where you might have a natural disaster like we had this summer. It would give them additional medication so that they can make it through. I'm going to err on the side of the patient, frankly.
Yeah, and I will as well. That is something that just stuck out in my mind, and I wanted to share that. It's not that we don't have skilled, wonderful healthcare providers, but all, I'm not a pharmacist, but I have dispensed. So, because I could, and remember that it's, the risk for error is high, but at the same time,
Senator Bradley.
So don't you run into the same problem with a 30-day supply, which is the normal, length of time prescriptions like this is good for? And I mean, the only thing the bill does is extend that normal time to 90 days. So it doesn't change who or how, right? So I'm just looking at the hearing testimony, and I think there was some support for a compromise between 30 and 90 days, and that's where we came up with 60.
We're only on the amendment right now, right?
Yep.
So
sorry.
dropping it back to,
Totally hearing that.
yeah, dropping it back to 60 would be the compromise, if that's okay.
Go from 90 to 60, correct?
Mhm.
Committee amendment.
Yep. Yep, thank you. So I'm piling through my papers. No, I'm gonna support it on the Christian side. I will, Cam, no, I'm gonna err on the side of the patient. I just wanted to discuss what a reservation of mine was.
Maybe
Fair
we can
enough.
tease it out in the house.
Okay. Let's follow it over there. Great, thanks.
All right.
So Senator Avard moved a committee amendment to change line 4 from 90 to 60. I didn't hear a second.
Second.
There we go.
Line 4.
All those in favor of a committee amendment changing it from 90 to 60 days on line 4, say aye.
Aye.
Opposed?
Move on to pass as amended?
Second. All those any other discussion? All those in favor of ought to pass as amended, say aye.
Aye.
Opposed?
Consent?
Second?
All those in favor of consent, say aye.
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 Kevin? Senator Avard, would you like to take this out?
Sure. No. Thank you.
Um, 496. We have an amendment.
I move on to pass on the underlying bill.
Second.
And there's a Chanley Bradley special, right?
Yep. Amendment 0676 S.
You're moving my amendment. Thank you very much. We'll make it Chandler Whitley Bradley.
Here we go. Is it 676A?
676 S.
676.
Any discussion? All right. All those in favor of amendment 0676S say aye.
Aye.
Opposed?
Move on to pass as amended.
Second.
All those in favor of ought to pass as amended on Senate Bill 496, say aye.
Aye.
Opposed? Consent?
Second.
All those in favor of consent, say aye.
Aye.
And Senator
I can take this out.
okay. Senator Whitley will be taking it out. $500. That's establishing a primary care provider loan repayment program and making an appropriation thereof.
Interim study.
All right, I'll second for the discussion. Go ahead.
Yeah, so I spoke to the bill sponsor. This is a very important constituent issue, but Senator Perkins Quokka is agreeable to an interim study and we'll want to discuss it in the budget next year.
Okay, yeah, because I think with the SLRP program, they have a lot of doctors utilizing that, and I think we need to kind of reevaluate that. What?
No.
Stay with us, Brenda.
Can I speak?
Oh.
She wasn't stopping it because I refused to turn in my old computer for the new one that is sitting there waiting.
Okay.
So I'm hobbling along for the session.
All right, so the motion is interim study on 500. Moved and seconded. All those in favor say aye.
Aye.
Opposed?
Consent?
Second.
All those in favor of consent say aye.
Aye.
Opposed? And Senator Prentice, would you like to take this on?
I would love to.
That's what that movement was. Okay. We only have two left.
All right.
555.
I move on to pass.
Second.
We have two amendments,
There,
correct?
Yeah.
the latest one is 800.
800.
Yes.
Okay, I would love to.
And I motion
Just walk through this and Chris will know too. All right, so which one?
800, and I move 800. What do you call it? Amendment 800. Yes. 0800. Yeah.
Can you
How do I
walk?
do?
Can you walk through the amendment?
I can walk through it, if you like.
You have to run slow.
Yeah.
Senator, do you mind going through your amendment?
Pardon me?
Do you mind going through your amendment?
Yeah, we're gonna go through it. So, the first part, as you can see, we,
It cuts into
it shows, what, as far
Medicaid.
as the annual and or quarterly reporting of this, and it just goes through the reporting requirements. It keeps the 50% on the rebates, line 79.
it also
Exempt
carves
Medicaid.
out the Medicaid that Henry Littman was so
Yeah.
concerned
But,
about.
yeah, the Medicaid, there's another program, which is the Ryan White HIV/AIDS program as well. That's on a second page, line 30, line 30-ish,
It's on my first.
31. And the state employee, self-funded plans such as the state employee. Yes, on second page, line 32.
Yep. See it?
Isn't that wonderful? Took care of it.
I know. I'm sorry, Cam. It's the short arm. Senator Avard, so you've got broad consensus from the stakeholders on this?
But that's what I believe, yeah.
Okay.
Okay, so where are we?
Well, I do think there is some opposition by the providers.
Yeah.
So I think that needs to be noted. However,
Providers or carriers?
carriers, yes, sorry.
Yes, not providers.
Let's see.
At least one of the insurers in New Hampshire is already doing this in large measure, and I think many other states are doing this, and I think it's time that we do this.
At a compromised rate. We're doing
Yes,
this
at
at 50%
50%.
instead of 100%.
Yes. The other thing I would add is that I believe that the amendment that Henry Lippman wanted, which is incorporated in this, is as much belt and suspenders as anything else.
Yeah.
But there is absolutely no harm in doing it if it makes the Medicaid director feel that we've clarified the situation.
Where are we?
So Senator Avard moved Amendment 0800S. I did not hear a second.
Second.
So we discussed before we second. No.
Any other discussion? All those in favor of Amendment 0800S, say aye.
Aye.
Opposed?
I move ought to pass as amended.
I'll second. All those in favor of Senate Bill 555, ought to pass as amended, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
Aye.
Senator Avard, take this out.
Yes. Thank you. One more?
One more.
And we get to eat. On my mind.
560.
What?
560?
Study.
Establishing a committee to study the impact of pharmacy benefit manager operations on cost administration and distribution of
I
prescription.
move out to pass.
Second.
Bill number again? Hold on.
560.
560.
Now that it's been moved in second, there was a request from the bill sponsor to remove quotation marks. Cam, do you have that? So I will move that once Cam tells me what
What line was that?
line it is.
Well, back for savings.
Oh, savings.
Clawback.
On
Oh,
line
yeah, yeah, yeah.
15,
Mine's 18,
15 and 17.
17.
Yeah.
She wanted the removal of both savings and clawbacks. Okay, so I moved that amendment, committee
Second.
amendment.
And move out to pass as.
Slow down. You got that? All
I
right.
move ought to pass as amended.
Nope,
Oh,
we have to vote on the amendment.
Oh, yeah.
That's why I said slow down.
Hungry.
All those in favor of the committee amendment, say aye.
Aye.
Opposed?
I move ought to pass as amended.
Second.
All those in favor of ought to pass as amended on Senate Bill 560, say aye.
Aye.
Opposed?
Consent.
Second.
All those in favor of consent, say aye.
Aye.
All right. Senator Whitley, you want to take this one?
Sure.
All right. Anything else that we want to discuss? I did, in the beginning, I did, and I think Senator Whitley, you took notice of it, that on 558.
Yep.
That I want all of the stakeholders
Yep.
working together on it.
Yep. And Senator Perk, I spoke to her this morning, and now that she's back in the office, she plans to do that.
Since we are discussing 558, I just want to say that when I drafted the amendment, foolish me, it was not intended or should not have been intended to just be men only. It should I mean, women only. It should be men
Oh,
and women
got it.
because both get fertility treatment.
Got it, got it.
So I am withdrawing that amendment.
Me too. All right, any other topics you want to discuss? With that, I'll hear a motion to get out of,
Motion
vote.
to move out of exec.
is that a motion to move out of exec, or do you want to say?
No, second.
Okay. All those in favor of moving out of exec, say aye.
Aye.
Opposed. All right, have a good break.
Thank you. Well done,
And-
Madam Chair. We'll see you
Well,
in an
I
hour.
know, but HHS is, jeez.
We're not being dismissed from class. You know?
You like, do not go home. You have to vote on a lot of bills at 1 o'clock.
Cam, do we have any house bills? We don't, oh, okay, we don't have any house bills yet, so, after session, have a good break.
Yeah.
Yes.
Did they all go on consent?
Yes.
Yeah. All right.